Welcome back, everybody. Back with our second Cabral HouseCall of the weekend. Can't wait to get into today's show. Yesterday was a great one. Hopefully you got to tune into those questions. That was episode 3445. Today, if you want to follow along, head on over to StephenCabral.com/3446. All right, let's dive right into it. All things wellness, weight loss, weight gain, anti-aging, what else? High performance health, longevity, you name it. We're going to tackle it. Let me just give my disclaimer up front. No medical advice, medical treatment plans, medical cures, medical diagnosis. There, we said it. Now let's dive into your questions. Jess is up first. What are some alternatives to daily nutritional support to get my vitamins and protein when I'm sensitive to stevia or monk fruit or artificial sugars? What would your daily multivitamin in pill form in addition to a bone broth protein be efficient? Okay, great. So daily nutritional support, whether it's daily nutritional support or any one of the 100 different formulas, we don't use any genetically modified, no GMOs, no artificial sugars, no artificial colors at all, ever. Never have. So I just want you to know that. Yes, there is stevia for sure, because we don't want to use ethanols or erythritol or any sugar alcohols. So you can't consume straight vitamins with no sweetener. It's pretty brutal. If you want to give it a shot, open up a multivitamin, mix it in water and take a sip. That will probably be the last time you do that. It's not dangerous for you, just very, very bitter. So you're on the right track though. Absolutely. You can take the daily activated multivitamin, which is exactly what's in the daily nutritional support, minus the healthy organic fibers and the protein, right? So the daily activated multi, you take 2 at breakfast, 2 at dinner. That's it. Simple, straightforward. You can even take all 4 at a time if you want. And then you would use your favorite protein powder. It's that simple. Honestly, that would give you all your vitamins, minerals, your antioxidants for your eyes, everything you'd get at that, which is great. And then just pick, choose your favorite protein. No problem at all, Jess. Again, if people want to check out the labs, if they want to check out all our formulas, if you've never heard about daily nutritional support, which is the community favorite, head on over to StephenCabral.com/shop. That takes you over to EcoLife. All right, Jenny is up next. Jenny says, hi, Dr. Paul. I'd love to get your thoughts on all the fillers I see so many women, young adult to mature adult, getting these days on their lips. I see ads stating the hyaluronic acid is healthy for the deeper layers of the skin and lips, but I'm skeptical and concerned for friends and family who get them with some frequency. I have no interest in getting them, but would love to know the real truth in the event that they are open to opinion about them. And I don't know what Botox really is. I'm interested in your thoughts on that also. I always cringe when I see people who have tried both or had both. They just don't look natural anymore. Thank you. Okay. So here's what I think. And I'll probably do a whole show in this because I don't want to go through exactly what I've done a show on Botox before. Botox is different than a filler. So Botox is a neurotoxin, and what it does, it essentially weakens the impulses, nerves, and does not allow for the laugh lines, the lines between the eyebrows, the crow's feet, all of those things. It essentially numbs that part of the face. I can give a more scientific version maybe in the future on another podcast, but I want to answer Jenny's questions here. So I want to be, really realistic as to like how we can share this with our friends. There's always the potential that it could cause an autoimmune issue, that it could cause facial paralysis. But again, think about it. Tens of millions of women and men use Botox, and it is, for the most part, fairly benign, especially if you do what more people are doing now, which is more micro Botoxing. And so they're not using mega amounts of it, which means that their skin isn't super pulled and shiny because they use so much Botox, that they're using just a more natural version. Now, I don't use any Botox, but my skin is shiny. My skin's shiny because I have a little bit more oily skin. Always have with my Mediterranean heritage, and I'm okay with that. And I've had laugh lines since I was like 6 years old. And again, I'm okay with that as well. But I totally understand, and I said that on yesterday's show when we were talking about breast augmentation. I'm here to support my clients. And you know what? For the most part, do everything naturally that you can. And then when you want to add on, if you choose to, the last 10% is icing on the cake. I'm here to support my clients. I do not say you shouldn't do that. What works for you as a human in this lifetime, enjoy it, stay safe. So I give people just the safest way to do it. All right. So again, so you use as little as possible. Same with the fillers. The problem with the fillers is that it stretches out your natural skin. Okay. It can damage the tissue layers below, sometimes circulation-wise, sometimes it blocks lymphatic drainage, sometimes it weakens and creates more inflammation, causing more senescent cells, which then further damages the tissue. So it's my opinion that it may weigh on and age the other tissue around it potentially faster. I don't know that, but what I see is that most people need more and more in order to maintain some semblance of the same results over time. So there's all sorts of fillers out there, right? So you've got, I think there's Restylans and Rejuviderms and all sorts of different fillers that you can get. Hyaluronic acid by its nature is going to be a little bit more natural. It's going to hold more water. The problem is you need to make sure that you're getting just the right amount on each side. If you do it on each side in order to stay balanced, like in the lips, we'll say, that you don't overdo it, because if you go back, it may have stretched the area itself. You might have more swelling around the area because of the poor lymphatic drainage. And then there's also the issue is that, yes, you're supposed to be able to use an enzyme to dissolve these fillers if needed in the future. But from I've spoken to colleagues of mine in the industry, and it's not always able to be dissolved. Sometimes surgically, you need to go in and remove the filler. So just things to think about, Jenny, and maybe to share with other individuals. I don't know that it will sway them. But again, as in general, less is more. That's kind of how I would look at that. All right. Jody's up next. Jody says, can you use Dijon mustard on the 7-day detox? Well, most mustards contain mustard seed and they contain vinegar, oftentimes white vinegar. So there's all different types to use. I don't know specifically. I know Dijon mustard. I don't know specifically the ingredients with Dijon mustard. But what I would say is if you need to use Dijon mustard for a little bit of flavor and all that, it's not going to hurt your detox results. It's not. White vinegar, not necessarily the best to consume. Apple cider vinegar, a little bit better, a lot more minerals. It won't strip the body, where white vinegar is going to pull more minerals out of the body. So honestly, fine. It's literally no big deal. I wouldn't use it if you don't need it, but it's not going to hurt your detox results. No, unless you're sensitive, of course, to mustard. Then yes, it would. All right, Julia's up next. I have a 2-year-old who is now being diagnosed with reactive airways, multiple inhalers, saying it's asthma with no cure. And a 10-month-old who has recently this month had multiple breath holding spells that are terrifying as a parent to have a child experience as you hold them in your arms. Our family seems to benefit from a low histamine diet after I had a trigger cleaning mold from an object in our new home, and 5 years all living with a home with black mold in the basement. All right, well, this all makes sense now because people seem to have been exposed to black mold. So that's an issue. But this can be fixed. It really can. Don't let doctors tell you otherwise. What probiotics or supplements can help young children, 10 months to, and a daughter that's 4, to become healthy from reactive airways, breath holding spells, histamine intolerance? We have an Air Oasis purifier now in the bedrooms. Also, wildfire air quality starting to be a problem here in the Midwest. Advice. Okay. So I actually have lots of podcasts on air quality, everything from the fires that were in California and previously in Hawaii, what we use for air filters. I've got podcasts on the mold-based protocol. So to me, kids have to be 3 years old to start our protocols. That doesn't mean we can't help care for them before 3 years old, but 3 years old, is that when we start protocols, then we do a children's dosage. So you can go to stephencabral.com/shop. And you can check out the mold protocol there. What I would recommend is working with an Equilife coach or an integrative health practitioner. You can find a practitioner that meets your needs, especially one in pediatrics that works with younger children, at integrativehealthpractitioner.org. All right, or just ihp.coach. Those are all individual practitioners. Maybe find one that works with children. This would be great because there's so many nuances that I would be remiss to say, you should do this, and then this, because I don't have a full health history. So in general, the probiotic that we start with is the Clean Gut Probiotic. We use an omega-3. We use a lower dose of the Daily Activated Multi, or the DNS, for kids over 3. And we begin the mold protocol for children over 3. All right. So depending on how close your 2-year-old is to 3 years old, we would work on that. And then we use one product that is great. That's called the Hist Pro. It's called Hist Pro. That has quercetin and vitamin C and all the things that help with high levels of mast cells in the body and histamines. I use it myself. I think it's a phenomenal product. And yeah, so that's where I would start. But get a cohesive plan. It's really worth it. It honestly is. And they could work with your whole family. So it's not like you just have to do one at a time. They could work with your whole family for sure. All right, let's do one more question. This one's from Judy. Judy says, is there any protocol or supplements that can help with low blood platelet count? My 86-year-old in-law has liver cancer and low platelet count. He has water retention all over his legs, even though he is taking water pills to remove the water. Any help is greatly appreciated. Okay, happy to help with this, Judy. Just obviously, just remember, I can't give you medical advice, especially since this is an individual with liver cancer. So 86 years old, I believe you said. We need to look at a few things. One is there can be liver damage, right? Inflammation of the liver, which affects your platelet stimulation formation. So the liver has such a huge role in the body for not only detoxification, but also manufacturing. So one issue with the low platelet count, the thrombocytopenia, is actually from the liver damage itself. So I can't even recommend particular nutritional supplements without you checking with your oncologist, but something like milk thistle helps you rebuild liver cells. I don't know. It's also called silymarin. I don't know that this individual could use those. So you'll always want to check your nutritional supplements with your provider, but getting in something like the daily nutritional support on a daily basis. If they're not on a blood thinner, using something like 2 grams of the daily omega-3 support, using vitamin D3, 5,000 units a day or so might be a good place to start. But again, you need to speak with your oncologist. Okay. Oftentimes the spleen can become enlarged as well, which starts to sequester platelets too, especially when there's liver-based issues. So there could be a spleen issue as well. The other big thing I would say is there could be just nutrient deficiencies that the daily nutritional support will help with, such as B9, which is folate, methylfolate, methylcobalamin for B12, B6, vitamin C, what else is needed? Calcium, magnesium, copper, zinc. All of those are needed. You don't have to take them individually. You can take them with a daily activated multi, or you can take them with a daily nutritional support as long as you can get the sign up from your oncologist. Some things that might help food-wise are dark green leafies or green leafy juices, or even wheatgrass or chlorophyll. All of these things have been shown to help build up red blood cells and platelets. That might be helpful. In terms of the water retention in the legs, there could certainly be lymphedema and other lymphatic-based issues. It could simply be that there's blood pressure issues now, and because of the inflammation or stenosis, where the blood isn't allowed to flow back up the legs. So you'll speak with your doctor maybe about raising the legs up on the wall, meaning like keeping the hips close to the wall, putting the feet up on the wall to allow things to drain down. You might talk to them about some light rebounding to move the lymphatic system. Might talk to them about compression socks. All of these things could be very helpful. Other herbs that are helpful with vein-based or edema-based issues are horse chestnut and butcher's broom and hesperidin. Those can all be great for moving that lymph as well for veins. All right. So hopefully this was helpful. I appreciate everybody tuning into today's show. I'll be back tomorrow, of course, with our mindset and motivation, one of my favorite ways to start the week. Take care, everybody. Have an amazing rest of the day. Thank you so much for being a part of this community. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.